Modern healthcare should be based on a combination of research, the clinical experience of your healthcare provider, and your wishes and values. You deserve to know the scientific facts about your healthcare. So your healthcare provider should know what the best available evidence is that's relevant to you, and they should share it with you when you see them. But not all things have yet been studied, so your healthcare provider also has to rely on their own clinical experience when caring for you. At the end of the day, your healthcare is your choice, and you have every right to make choices based on your own values and beliefs. This is in fact known as evidence-based practice or evidence-informed practice. Your healthcare providers are taught to share with you the best available scientific evidence in easy-to-understand language without any silly jargon. They're also taught to share with you their own clinical experience, and then to allow you to make your own healthcare decisions. Chiropractic has a great scientific basis that is growing every day, so you can take great comfort in knowing that there has been lots of research done about chiropractic care. We know from many research studies that chiropractic is safe, and that people who see chiropractors really love the care they receive. We know from the science that chiropractic care improves your brain's ability to see what's going on in and around your body. This means you can have all sorts of improvements in your health and function, other than just the reason you went to see a chiropractor to begin with. Many people say they experience improvements in things like the way they breathe, or their blood pressure, or even their digestion when they get adjusted, irrespective of whether they saw their chiropractor because they were in pain or not. How cool is that? We also know from science that people who have spinal problems such as back pain, neck pain, and headaches improve well under chiropractic care. Let me give you an example. Low back pain may be due to a breakdown in the way your brain is controlling the muscles of your back. So your back and brain aren't talking to each other properly, which may mean that you aren't able to control and stabilize your spine properly and protect yourself from injuring your back, for example, when you move or lift an object. This is where a chiropractor can help. A chiropractor will gently adjust any dysfunctional spinal segments in your back, or what they call chiropractic subluxations. They do this to restore healthy spinal movement and to improve the communication between your brain and your body, which may have an impact on the way your brain is controlling the muscles in your back. For many people with back pain, this can result in a big difference to the way they feel and function, and it can help them to get over their back pain and back to enjoying life. The research backs this up and tells us that for people with low back pain, chiropractic care is as effective, if not more effective, than other healthcare options. More research needs to be done to work out just how effective it is, but for now, the research suggests that there's no better healthcare options available. The same is true for other conditions such as neck pain and many types of headaches. There's also lots of research being done that looks at how chiropractors can help people with all sorts of problems that may be caused due to a breakdown in communication between your brain and your body. It turns out that spinal function is really important for your brain to know what's going on in and around you. So when you see your chiropractor, you can feel secure, knowing that the care they provide is backed up by research as well as their clinical experience. But remember, your healthcare is your choice, and you can make choices based on your own values and beliefs. And this lies at the heart of evidence-based healthcare. So have you seen your family chiropractor lately? If not, go have your brain-body connection fine-tuned, because chiropractic is all about helping you feel great and get the most out of life by functioning at your optimal potential. After many years of research, we now know beyond a doubt that spinal function impacts and changes brain function. Scientists call these changes that happen in our brains neural plastic changes. Neural plastic changes are happening all the time because our brain is continuously adapting to our ever-changing environment. When your spine is not moving properly, this leads to changes in the way the small muscles closest to your spine and skull send proprioceptive information to your brain. Proprioception means your brain's awareness of the position of your body. So it's your brain's ability to know where all the parts of your body are in space. The proprioceptive information that comes from the muscles closest to your spine and skull help your brain to know what's going on in your spine, which represents the core of your body. For your brain to accurately move your arms and legs, your brain needs to know exactly what's happening in your spine. This ability to move accurately, based on sensing what's going on in your body, is a process known as sensory-motor interaction. Sensory-motor interaction basically means your brain's ability to take all the information it receives from your body and your environment and put it all together to make sense of it, and then to create just the right sort of movements in response to that sensory information. For example, moving your hand to catch a ball that has been thrown to you. But how does this relate to your spine? If we look at spinal function in a very simplistic way, there are really 3 things you want your spine to do on a regular basis. Sometimes, for example, if you're running, you want your spinal bones to move in a synchronistic or harmonious manner to disperse the forces generated from the running. By moving in harmony, the forces are shared equally across your spinal bones so no damage takes place. But other times, for example if you are lifting a heavy object, then you want your spine to stiffen up to protect you. Without all your muscles stiffening up like this, you could injure yourself. So how does your spine sometimes move and sometimes stiffen up? Well, your brain does this for you by activating the muscles around your spine and skull, which are called your paraspinal muscles. Your brain activates the correct muscles, in the correct order, to the correct degree, with perfect timing, to either allow for synchronistic movement, for example during running, or to allow your spine to stiffen up, for example during heavy lifting. In addition to this, your spine muscles also, at times, need to automatically respond during times when you're expecting some sort of postural challenge, such as a trip or a slip. If you are tripping over, you need your brain to automatically, without consciously thinking about it, switch on and off your correct paraspinal muscles very fast to help you maintain your balance and stop yourself from falling over. This automatic activation of your spinal muscles is also important during arm and leg movements to stabilize your body and prevent injuries. So when you have spinal dysfunction, or what chiropractors call a subluxation, your brain is simply not controlling the movement pattern of a part of your spine appropriately. For example, your brain may not be moving your spinal bones in harmony when it should do, or it may not automatically be responding to postural challenges at the right time. So how would you know if you were subluxated? Well, often you don't know because you might not feel any symptoms right away. They may end up causing neural plastic changes in your brain that lead to back or neck pain, but they may not. For some people, they may result in clumsiness because you're not controlling the movements of your body properly. For some people, they may just cause weak muscles, or reduce sports performance, or difficulty reading, or simply the worsening of other conditions such as colic or bedwetting, or perhaps high blood pressure. We simply don't know yet how a subluxation is going to affect you. But we do know when your spine isn't functioning well, if you're subluxated, it does interfere with the way your brain and body communicates, and the way your brain controls what's going on in your body. When a chiropractor adjusts these subluxations and improves the function of your spine, this results in better communication between your brain and your body, which may have an impact on the way you feel if these subluxations were causing symptoms for you. Or it may mean that your brain is better able to control what's happening in your body, so you can perform at your optimal potential. So if you want to have a tune-up of your brain-body communication, go and see your family chiropractor and have your spine tuned up so you can function at your best. Do you suffer from headaches, or do you know someone who does? If you do, know that you are not alone. The head is actually the most common site of pain in the body. Headaches can range from mild head ache, pain, or tension that comes and goes, through to constant, intense, throbbing pain, so bad you have to crawl into bed with all the curtains pulled and a bucket by your side to throw up in. Some people find it difficult to describe their headache or their head pain. However, others commonly describe their pain as throbbing, squeezing, constant, unrelenting, or intermittent. The pain may be in one part of your face or skull, or it may be generalized, involving the whole head. Headaches may arise seemingly out of the blue, or they may be associated with particular types of activity, such as computer use or during or after exercise. A headache may start abruptly, or it may come on gradually over time. It may reoccur time and time again, exactly the same, or it may get worse and worse each time you have one. A headache is often associated with nausea and vomiting. This is especially true with migraine headaches. Headaches, like any pain in the body, is a sign that something is not quite right. Your brain will create for you the sensation of pain if it thinks there's something wrong, or if it thinks there's a potential problem. For example, your brain will give you a headache if you have taken too much medication, letting you know that there is some chemical toxicity going on. And some headaches are a warning of life-threatening illness. Such headaches are usually associated with fever, a stiff neck, muscle weakness, or changes in sensation on one side of the body, changes in vision, vomiting, or change in behavior. But for most people, headaches are not a sign of life-threatening illness, and are more the consequence of lifestyle and daily behavior. We know now from a lot of neuroscience research studies that when your spine is not moving properly, this changes the way your brain perceives what's going on in and around your body, the way it integrates all sensory information, and the way it controls your body. The movement of your spine is, in other words, very important for your brain to know where you are in space. And since you cannot see your spine with your eyes, your brain relies on the information it receives from the small muscles closest to your spine and skull. If the segments of your spine are not moving properly, what chiropractors call being subluxated, this may for some people manifest as headaches. Others may experience back pain, and some babies may experience colic, and for some kids, they may not be fully aware of their bladder at night and may end up with bedwetting. And I could go on and on and on. Research has also shown that when a chiropractor then gently adjusts these subluxations, those spinal segments that aren't moving properly, it helps the brain to more accurately see what is going on in and around the body. This helps your brain to accurately feel or see what is really happening in your body, so it can properly control and regulate what is going on. It doesn't have to guess or make stuff up anymore about what movements you should be making, what your autonomic system should be doing, and what symptoms you should or shouldn't be feeling. Remember, pain is something your brain creates for you if your brain thinks there's a threat of tissue damage, or even just if there is a potential threat of tissue damage. So when you get adjusted by your chiropractor, if your spinal dysfunction was manifesting as headaches, these may improve. If your spinal dysfunction was manifesting as back pain, then this may get better. Or if it was manifesting as colic or bedwetting, then these symptoms could improve as well, and so on and so on. So let's look at what the research shows us about chiropractic care and headaches. Researchers have reviewed all the randomized control trials that have looked at the effects of chiropractic care or spinal manipulative therapy on headaches. In these studies, they have compared chiropractic care to sham care or other interventions, and the results show that chiropractic care does help some people with headaches and migraines. In one study conducted in Australia and published in 2000, the researchers looked at 127 people suffering with migraines. The researchers looked at the effects of 2 months of chiropractic care compared to 2 months of no chiropractic care, and recorded the participants' migraine frequency, duration, disability, and medication use. After 2 months, they found that the chiropractic group got better compared to the control group, with all their migraine outcomes that they looked at. They found that for about 1 in 5 people, their migraine almost went away completely after 2 months of chiropractic care. And for half of the study participants, their migraine frequency significantly reduced. The results of this study suggest that a large number of migraine sufferers respond really well to chiropractic care. We don't know for sure who will respond well, and we don't know how much of an influence the placebo effect has. But for some people, when they get under chiropractic care, their migraines almost completely resolve within just a couple of months. Looking at another study, published in 2010, 80 patients with chronic cervicogenic headaches received 8 weeks of chiropractic care. Another group of 80 patients with chronic cervicogenic headaches received 8 weeks of light massage. The researchers compared the patients' pain scales relating to the headaches and the neck pain, and also the frequency of headaches and their medication use. They also looked at whether it made a difference seeing a patient once or twice a week, and they followed them up over a 24-week period. What they found was that patients receiving chiropractic care improved significantly compared to the control group that was receiving massage. Pretty much all of the pain and disability scores were better in the chiropractic group. And for some of these pain scores, the improvements lasted the full 24 weeks. The chiropractic group also had fewer headaches and took less medication by the end of the follow-up period. There appeared to be a small beneficial effect from being seen more often, but the results of this study weren't conclusive when it comes to frequency of care. The chiropractic group in this study were over 3 times more likely to have a significant improvement in their headache symptoms compared to people receiving light massage. So for some people, if their spines are not functioning well, it can cause headaches or migraines. But for others who have spinal dysfunction, what chiropractors call subluxations, it may cause back pain or neck pain. And for others, it may cause clumsiness or reduced sports performance, or changes in your mood, or completely other symptoms, such as colic, bedwetting, or high blood pressure. The thing is, we don't yet know exactly how subluxations are going to affect you. We need to do a lot more research to figure this out. But in the meanwhile, why don't you consider chiropractic care? Make sure your spine is functioning well so you can operate at your best. You may be wondering if spinal dysfunction really can affect your brain. So let's look at some very interesting research that has explored exactly this. A group of New Zealand-based researchers and another group in Canada have over the past 10 years done many experiments comparing brain function in people with a history of spinal dysfunction and a group with no spinal problems whatsoever. The spinal dysfunction group was called the subclinical pain group because they were not in any kind of pain on the days of the experiments, but they had a history of spinal problems. So subclinical pain refers to people who have recurring spinal dysfunction, such as mild pain, ache, or stiffness, with or without a history of known trauma. There is an increasing interest in subclinical pain in the scientific literature because individuals who fall into this category provide an opportunity to explore how spinal dysfunction affects their brain without the complications of current pain, because pain itself is known to alter brain function. We already know that once you are feeling pain, it changes how your brain functions. But what the research on subclinical pain is showing us is that even just mild recurring spinal problems, even on days you feel no pain, can also alter how your brain functions. Let's take a closer look at some studies that have compared these people with subclinical pain with people who have never ever had any spinal problems at all. Well, this is where it gets interesting. The brains of people with a history of spinal dysfunction are less accurately aware of where their arm is when they close their eyes. You need your brain to know accurately where your arms are all the time to be able to move without having injuries. Another study showed that the brains of people with spinal dysfunction were slower at mentally rotating objects in space compared with a healthy control group. This suggests that your brain's ability to mentally rotate objects is affected by the function of your spine. We need to mentally rotate objects in space all day, every day, but we often don't think about the fact that we do this. Being able to accurately perceive where you are and where your arms and legs are is very, very important. You need to know where you are to be able to move without having accidents. And it's also very important to be able to accurately perceive the world around you. This is a vital skill we need all day, every day. To recognize some objects, you may need to mentally rotate them. For example, to recognize the letter P versus the letter B, if they are not upright, you would need to mentally rotate them in your mind to figure out which letter it was. We all mentally rotate shapes and objects that we see, but we do not often think about that we do it, or how important it is for our daily life. Another study conducted in Canada recorded brainwave responses to mild electrical stimulation at the wrist before and after a 10-minute task where they had to do precise movements of their hands. There were significant differences between the spinal dysfunction group and those who had healthy spines, demonstrating again that the brains of those with mild recurring neck pain, even on days they had no symptoms at all, processed sensory and movement information in a different way compared to people with totally healthy necks. They also found that only the healthy neck group could remember or learn the hand movements, but the neck dysfunction group could not. So even this kind of mild neck dysfunction was changing the way the brains were able to learn movement patterns. In another study, scientists in Canada found that individuals with poorly functioning necks are not as good at processing sensory information from their different sensory organs, like their eyes and ears, compared with people with healthy necks. Being able to accurately process multimodal sensory information becomes very important as we age, as poor multimodal processing is a risk factor for falls in the elderly. This is where chiropractic could help. Chiropractic care has been shown to improve the way older adults process sensory information together from their ears and eyes. A study was conducted in Auckland, New Zealand, with 60 older adults, half of whom received 3 months of chiropractic care, and the other half that did not. Those who received chiropractic care were better able to accurately perceive sound and visual information at the same time after the chiropractic care. Adjusting dysfunctional spinal segments, or what chiropractors call vertebral subluxations, has also been shown to improve the brain's ability to perceive where the arm is in space when subjects close their eyes. This was in the same group mentioned earlier who had a history of spinal dysfunction. Chiropractic neck adjustments have also been shown to lead to faster mental rotation. Another study has shown that adjusting dysfunctional spinal segments in people with subclinical neck pain improves their brain's ability to contract their leg muscles. It actually makes them stronger. So one thing is becoming very clear. The function of your spine impacts the way your brain works. So why not take good care of your spine with a regular checkup with your family chiropractor? If you have been adjusted before by a chiropractor, you may have noticed a popping sound that may seem a little strange. Many people think all kinds of strange things about this popping sound, so let's set the record straight. The popping sound is only the formation of gas within a joint, and it's no more significant than any other gas release from the body. The popping sound does not mean that you're getting arthritis. A number of studies have looked at people who have routinely cracked their knuckles for years and years and compared them to non-knuckle crackers to see if there's any difference in X-ray images of their hands. These studies all came back with the same conclusion. Habitual knuckle cracking over the course of several decades is not associated with clinical or radiographic evidence of osteoarthritis. Of course, you could argue that the spine is part of your weight-bearing system and hands are not. So you could ask, can you really compare the two? But all the evidence that is available suggests that cracking joints has nothing to do with causing arthritis. The popping sound does not actually matter at all. Whether or not you hear the popping sound makes absolutely no difference to how good the adjustment was. There have been several research studies that have looked at whether adjustments with the popping sound meant that there were better outcomes for the patients being adjusted. But all these studies show that it makes no difference whether or not there was a popping sound. All it really means is that the chiropractor adjusted you really fast. We do know that higher adjustment speed means that you are more likely to get a popping sound. But this popping sound does not mean that you'll get better outcomes from your adjustment. Silent adjustments, if they improve spinal function, are just as good as loud popping ones. There have been all sorts of theories about what the popping sound really is. Some have thought the sound was caused by tendons snapping over a joint, or a bone being put back into place, or the snapping of adhesions or scar tissue. Recently, there was a really cool study done that actually looked at what was happening in a joint when there was popping sounds. The researchers of this study used video magnetic resonance imaging to study what happened in a person's finger joint when they pulled his finger until his knuckle made the popping sound. So they used a cable attached to his finger and slowly pulled his finger until it cracked, while recording this with video MRI. They also measured the space between the joint surfaces before and after the crack using automatic computer software. What they found was that the joints remained very close together during the early stages of the finger being pulled. And then when the force of the pull was strong enough, the joint would very quickly separate and a bubble would form. And this was when the popping sound was heard. This means that the popping sound you hear when a chiropractor adjusts you is simply a change in state between liquid and gas within a joint. There is a really cool name for this too. It's called tribonucleation. Try that one after a few drinks. It's actually very similar to what happens when you open a champagne bottle, but it's all happening in an enclosed joint space. Early on, it was thought that the popping sound was associated with unhealthy joints. But as far back as the 1930s, scientists were showing that this also occurs in perfectly healthy joints. So keep this in mind next time you get adjusted by your chiropractor, that the popping sound doesn't have anything to do with bones grinding or rubbing, but instead is simply gas bubbles forming within a joint as your adjustment separates the two joint surfaces that are very close together.